Clinical Judgment, Week 14. We have a client who is a 67-year-old female admitted with chest pain and shortness of breath. These are her symptoms. She has nausea with heartburn for 2 hours. Her blood pressure is 160/84. Her heartburn has evolved to a dull pain spreading to her shoulders. She has a temperature of 99.3. She has chest pressure. She took Tums without relief. She was at a family cookout. She has a respiratory rate of 28 breaths per minute. Her heart rate was 118 beats per minute. Bowel sounds are active ×4. Lungs are clear to auscultation. She has shortness of breath. She has a history of unstable angina. And she has an ST segment elevation. So again, what findings are relevant or most important at this time? Again, let's look at what is really pertinent to this client. And remember, just because it's abnormal does not necessarily mean that it is relevant. And remember, just because it's normal doesn't necessarily mean that it's relevant. This is what I've selected. We have nausea with heartburn for 2 hours. We know this can be caused by GERD, but we also know that these symptoms can potentially be symptoms of an MI. We also know it could be symptoms of cholecystectomy. We have that elevated blood pressure. We have the elevated respiratory rate and the elevated heart rate. We know that all of those things can be from a fluid imbalance or hypoxia, but definitely decreased perfusion. The heart has to work harder, the body has to work harder in order to perfuse the body. So, could be symptoms of an MI, could be symptoms of fluid volume imbalance. That heartburn that has evolved to a dull pain, again, this could be anginal pain. It can be symptoms of an MI, cholecystitis, or GERD. With everything she's got going on, I'm kind of leaning to the angina and the MI. That chest pressure, again, could be the GERD or cholecystitis, but I'm looking at MI or angina. Potentially it could be respiratory, but in her case, I'm really thinking it's cardiac. She took Tums without relief. Well, it's really important for us to know what treatments were done and the client's response to those treatments. But maybe it was the inappropriate medication or administered inappropriately or incorrect dosage. But we also need to stop and think, if this was GERD that she was having, Tums would have relieved it. And it did not. So we're also looking at shortness of breath. If the heart is not pumping effectively, we have poor perfusion. The body is working harder, it's breathing faster to take in more oxygen so that can be perfused to the body. If the client is having an MI, this would be very likely. We have the history of unstable angina. Well, that is definitely a clue as to what could be going on with her right now. Unstable angina can very easily morph into an MI. And that ST segment elevation is an indicator of an acute MI. Complications, that nausea, heartburn, definitely some esophageal erosion, dehydration, but we're thinking MI here. The blood pressure, CVA, aneurysm, decreased cardiac output. If we're having an MI, we're already having decreased cardiac output, and that elevated blood pressure is not going to help. That heartburn, MI, could lead to cardiac arrest. Her chest feeling tight could lead to cardiac arrest, respiratory failure. The Tums without relief, if she took it multiple doses, could lead to metabolic alkalosis, elevated respiratory rate, respiratory alkalosis or respiratory failure, the elevated heart rate. We have decreased cardiac output with elevation. We already have decreased cardiac output if she's having an MI, which I fully think she is, and that can also lead to heart failure. Shortness of breath, the respiratory alkalosis, respiratory failure, history of unstable angina, cardiac arrest, excuse me, and ST segment elevation, potential complication, cardiac arrest. I think she has an MI going on. I really do not think that this is angina, which angina technically is chest pain. So yeah, she is having some angina, but I think ultimately it is an MI. We have to deal with her chest pain because remember, as long as she's having pain, she's having some ischemia to the tissues, and that will be exhibited by pain. And if we do not relieve that ischemia, she's going to have tissue death. So we also need to decrease the workload of her heart. So we want there to be no chest pain, vitals to be within normal limits, and we want no damage to the heart tissue. Is there anything we would avoid? Well, we would definitely avoid activity because activity is going to increase the workload of the heart. What are we going to do? We're going to monitor vital signs for sure. And if she's having the MI, which I fully think she is, we're going to do MONA, morphine, oxygen, nitroglycerin, aspirin. We have to have IV access. We need to get that EKG on her, and we will do serial EKGs because we need to know how long this myocardial infarction is occurring. We're going to do serial cardiac markers with the lab. We need to know how long this infarction is occurring. We'll also do a CBC in chemistry and a chest x-ray. We definitely need to get this lady for the percutaneous transluminal angioplasty, in other words, a cardiac cath. And she may require a CABG if we're unable to relieve the blockages from the cardiac catheterization. We could also do the thrombolytics to dissolve any blockage caused by blood clots, followed by anticoagulants to prevent the formation of additional blood clots. We need to decrease the workload of the heart, so she'll be on bed rest. Following the MI, then she'll go through cardiac rehabilitation. and education to include medication and administration, and how to maintain her heart health at this point. So our priorities, once again, were no chest pain, vitals within normal limits, and no damage to the heart tissue. So what do we do first? We need to do MONA. We're going to do the PCTA, potentially thrombolytics, and we're going to do the serial cardiac markers and EKGs to determine if there is any damage. Bed rest and monitoring vital signs would fall in there also. Does our client have no chest pain, normal vitals, and no damage to the heart tissue? Which client do we see first? Is it the client with the right foot cold and pale, cap refill of 10 seconds? Is it the client with intermittent claudication, pain relieved with rest? Is it the client with CHF and weight gain of 8 pounds in 7 days? Is it the client with AFib, heart rate of 101, blood pressure 142/89, and bilateral extremity edema? Again, ask yourself, which client, if I don't treat them right now, is at risk for serious consequences up to and including death? The correct answer, number 1. The client is not getting perfusion to the right foot. Excuse me. We have minimal blood flow. So now we have a client reporting chest pain. The nurse administers a sublingual nitroglycerin tablet. Excuse me. After 5 minutes, what is the nurse's next intervention for this client? What is the question asking? Well, the client has chest pain. We're giving nitroglycerin. After 5 minutes, what would happen next? Is it apply oxygen at 2 to 4 liters by nasal cannula? Is it administer morphine sulfate IV push? Is it recheck the client's pain intensity and check vital signs? Is it notify the healthcare provider and administer a chewable aspirin? Well, hopefully we already have oxygen on the client. We're giving the nitroglycerin to help dilate blood vessels and improve perfusion. So we need to recheck the pain intensity, check their vital signs, make sure that we have not dropped the blood pressure too far, and re-administer a nitroglycerin if the client still has pain. The nurse takes the morning blood pressure of a postoperative client. The reading is 90/50. What does the nurse do next? Well, what is the question asking? How about what is the importance of a blood pressure of 90/50, and or what interventions should be done for this blood pressure? Should we report the reading to the primary nurse as a possible sign of hypovolemia? Yeah, nurse needs to know this. Would we assess the client for subjective feelings of dizziness or shortness of breath? Yeah, we need to know if there's any other symptoms going on with a low blood pressure. Would we check the client's chart for trends and morning vital sign readings? Yes, we should do this. Maybe this is normal for the client, but how do we know if we don't check? Would we notify the charge nurse to verify the significance of the finding? Yes, this is a critical issue. We need to make sure that the charge nurse is aware of what's going on. Would we call a code blue? No, the client still has a pretty decent blood pressure, but we definitely need to address this. Would we place the client in reverse Trendelenburg position? Well, Trendelenburg is laying the client on their head, basically, so feet elevated, head lowered, and that's going to improve blood pressures because it is getting the blood to those vital organs. Reverse Trendelenburg is elevating the head and lowering the feet. So, no. Correct answers 1, 2, 3, and 4. We have an African American male being seen for a blister on the right toe. What factors increase the client's risk for developing atherosclerosis? What is this question asking? Well, what are risk factors for atherosclerosis? Really does not have anything to do with a blister on the right toe. So, would it be a 20-year history of type 1 diabetes? Yes, we know that type 1 diabetes does, and type 2 increases the risk for atherosclerosis. Sedentary lifestyle. Yes, they're not burning off the fat they're taking in. Excuse me. Father with a history of colon cancer. Excuse me. That has absolutely nothing to do with atherosclerosis. The client is 35 pounds overweight. Yes, that means probably an inappropriate diet, not enough exercise, which we already know increases the risk for atherosclerosis. A grandmother who died after a myocardial infarction. Yes, atherosclerosis is a cardiac issue. The grandmother had a cardiac issue. Drinking 2 to 3 diet sodas per day. Does that have anything to do with atherosclerosis? No, but it might have something to do with hypertension. Diet sodas are very high in sodium. The nurse is interviewing a client with a history of high blood pressure and heart problems. Which statement by the client causes the nurse to suspect the client may have heart failure? What is the question asking? What symptoms are seen with heart failure? Is it, I notice a very fine red rash on my chest. I had to take off my wedding ring last week. I've had fever quite frequently. I have pain in my shoulder when I cough. Well, heart failure symptoms, edema, shortness of breath, etc. I had to take off my wedding ring, probably because it was getting too tight because of edema. When is B-type natriuretic peptide or BNP produced and released for a client with heart failure? What is the question asking? What is BNP? What does BNP tell us? When a client has an enlarged liver, when a client has fluid overload, when a client's cardiac output is lower than normal, when a client has ventricular hypertrophy. The correct answer is actually number 4. It BNP is released when the ventricles are enlarged, usually due to fluid volume overload. So we're looking at the heart, so ventricular hypertrophy, not just fluid overload. Last question. The nurse is taking vital signs and reviewing the ECG of a client who is training for a marathon. The heart rate is 45 and the ECG shows sinus bradycardia. How does the nurse interpret this data? What is the question asking? Well, we may need to know what happens to a client who has a low heart rate, or why would a client have a low heart rate? Is it a rapid filling rate that lengthens diastolic filling time and leads to decreased cardiac output? Is it the body's attempt to compensate for a decreased stroke volume by decreasing the heart rate? Could it be an adequate stroke volume that is associated with cardiac conditioning, or a common finding in the healthy adult that would be considered normal? Well, we know that a heart rate of 45 is not necessarily a normal heart rate unless we have cardiac conditioning. We have a very physically fit person. They may have a heart rate that low, and for them that would be normal. Correct answer, number 3.